Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, April 24th, and this is my daily briefing. So far in Missoula County, we've had a total of 41 cases. That means that we haven't had any new cases in the last couple of days. 39 of those cases were identified by testing, and 2 were epi-linked. We have had over 30 recoveries and one death, and we've got 9 that are currently still in isolation. The state of Montana has had a total of 444 cases and has had 14 deaths. First, I want to talk about our reopening plan for Missoula. This afternoon, we will be providing an update to the press and the public on our local reopening plan. We want to thank everyone for your patience and for your feedback. We also appreciate that the business owners that have reached out to provide their expertise on reopening guidance. We're encouraged by our community's response, and we will get that information to you very soon. For those of you who haven't had a chance to provide feedback, you still can. Our website has a comment portal for feedback on the COVID-19 plan, so please visit our Facebook page or our website at missoula.co/cvirus. Please recognize that the places that the governor has chosen to keep closed, such as gyms, pools, spas, and theaters, we cannot reopen by local order. Our local decisions have to be as stringent as the governor's decisions. So I also want to talk about testing asymptomatic cases and screening for COVID-19. We've been getting questions about the types of testing that we're offering at the Missoula County COVID-19 Testing Center, as well as who is eligible to get tested and why. We offer the Rt-Pcr diagnostic test for COVID-19. This test uses a swab to sample the inside of your nose, and the sample is then shipped to the lab in Helena. The lab extracts the RNA, or the virus's genome, copies it many times, and then uses the markers to identify it. This test is not used to detect past infection or lasting immunity, nor does it assess one's risk of developing COVID-19. It's a diagnostic test to tell if someone's symptoms are caused by coronavirus. The CDC has published testing protocols for how to use this test. It includes how to sample and who to test, and we follow those CDC guidelines. Right now at the Missoula County COVID-19 Testing Center, we're testing Missoula County residents with symptoms consistent with COVID-19 infection. We're also testing symptomatic healthcare workers and first responders who are employed in Missoula County. All testing is by appointment only, and this service is provided by our county and must go to our Missoula County residents or healthcare workers and first responders. If you're not a Missoula County resident, but you're having symptoms of COVID-19 and would like to get tested, please see a provider or call your local health department for more information. If you are a Missoula County resident and you call our testing clinic and are screened out, it's likely that you don't have symptoms consistent with COVID-19 infection. If you have a stuffy nose, itchy eyes, or symptoms that are more consistent with cold or seasonal allergies, you would not qualify for testing for COVID-19. Additionally, if you do not have symptoms and you are healthy, you do not qualify for testing. Something that many people don't understand is that the Rt-Pcr test that we are using is inefficient to use on asymptomatic people. If we test you today and you don't have symptoms, in 24 to 48 hours, we'll likely find out that you were negative. All that result means is that on that day, at that moment, you were free of COVID-19. That doesn't mean that you won't get sick or become a COVID-19 carrier later. All it means is that on the day of the test, you were free and clear. So to put this another way, we would have to test asymptomatic people each and every day to determine if they have the virus, and we would have a 24 to 48 hour lag time to get those results. Not only would this be inconvenient for the person being tested, but we wouldn't have the sampling supplies to do this for every Missoula County resident, and no lab in the state has the capacity to be able to process that many tests. What this would do is really just deplete our resources, strain the labs, and extend the turnaround times for tests for symptomatic people, which could harm our ability to be able to do contact tracing. Even if you're quarantined due to travel or other exposure, testing you if you don't have symptoms is a waste of resources with little net gain. Again, you'd have to be tested daily, and even if your test came back negative each day during quarantine, you'd still have to stick out the 14 days of quarantine. I'm sure you're wondering why that is. Your test result will always be 24 to 48 hours behind. So learning that you're negative a day or 2 days before gains nothing for you. And again, a negative test during your quarantine doesn't mean that you won't develop symptoms later in the 2-week period. All that test will tell you is that you were negative for the virus on that moment of that day of testing. So the tests that we have at the clinic are reserved for people who have symptoms that are consistent with COVID-19. If you think you've had COVID-19 previously, you do not need to call for an appointment. The tests that we provide will not be able to determine if you've had past infection or indicate if you are immune. For that, you would need an antibody test. However, as we've discussed previously, there are no FDA-approved antibody tests. There are 3 that have received an emergency use authorization, but none of those tests have been fully assessed for accuracy. When we can provide antibody testing, and that's unknown at this point, we need it to be approved and we need to know that it's accurate. Additionally, more research is needed in order to determine how to interpret the results of antibody tests. It's still really unclear how these test results relate to immunity, such as how long you are actually immune, or if you have enough antibody reaction to keep you from getting it again. Something else to note is that antibody tests should not be used to diagnose COVID-19 infection alone. If someone has symptoms, the Rt-Pcr test, like what we offer at our testing clinic, is better, as it can take multiple days for antibodies to develop and be detectable in the blood. An antibody test would miss a diagnosis at the beginning phase of an infection, which is particularly concerning since this is the time when people are the most infectious. So in summary, our testing clinic provides a diagnostic test for active COVID-19 infection to Missoula County residents and Missoula County healthcare workers and first responders that are practicing in Missoula County. We do not test asymptomatic people, as the test will not reflect previous exposure or potential to develop the virus. We also don't test for antibodies to verify past infection at this time. How and when we would be able to do that antibody test is uncertain. Again, we will update you as we get additional information on these subjects. That's all I have for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr, CindyFarr. You can follow us on Facebook at the Missoula City County Health Department. You can call our 258 info line if you are having symptoms that are consistent with COVID-19, which are shortness of breath, cough, and fever over 100.4. And they can help get you scheduled for an appointment through our testing clinic. You can also get additional information on COVID-19 at that 258 info number. And you can check our website at missoula.co/cvirus for additional information or to provide feedback. And again, thank you for being patient with us and everything that you're doing in the community to help slow the spread of this disease. And we will have more information coming out by the end of the day regarding health officer orders and what our reopening plan is. Okay, until Monday, everybody stay healthy. Thanks.